Families of children who have Lennox-Gastaut syndrome should recognize there's more than just medical therapy available to them. Medicines aren't always going to be successful. They may have to move on to dietary therapy or surgical therapy.
The kind of surgery that's typically done is a vagus nerve stimulator, and that has helped a number of people with drop spells. The risk is negligible, and if it doesn't work, you don't put a new battery in or shut it off.
So she went and had the VNS done, and we just sort of were in hold mode while we waited to see if that was going to work. Eventually she went on the ketogenic diet.
Dietary therapy does seem to work well for some patients, but it does require a whole change in lifestyle, not only for the patient but for the family. The whole goal of the ketogenic diet is to avoid carbohydrates and to get a high fat load.
You don't dabble in the ketogenic diet. It is a very strict process.
It is not a diet that should be taken on by families without partnership with their healthcare professionals.
Anytime we go to the doctor, her nurse goes with us and we have the nurse take her out of the room. Because Heather does absorb, I know, a lot more than we realize that she does. And there's no sense in causing anxiety in her. The corpus callosotomy was first mentioned to us about a year ago, and I would not even discuss it because I was with the mindset that there was still medications that we could try, and that was it. I was not even going to hear it. But her seizures got to be so severe that it was no longer even optional. We just told her that she was going to go have surgery to disconnect some wires in her brain that were making her have seizures, and it was going to help a little bit. And that was all we told her, and she accepted it, just like, okay.
Corpus callosotomy is where the part of the brain that connects both right and left hemispheres is split. And this has helped a number of people with drop spells. It is an option that should never be shut out and not discussed. But to think that all seizures are going to go away is not usually the case.
Decisions about surgery have to be made as a joint decision. From the medical side, we need to fully evaluate the child to see whether surgical benefits outweigh surgical risks. From the parent side, they need to come to an understanding of why the surgery could be a benefit, what the risks are, and do the benefits outweigh the risks. It's a very daunting task, and it doesn't happen overnight, but it's important to consider for families whose medications and diet have not helped.